Have you been told you have fatty liver after an ultrasound or a blood test in a regular checkup? Do you know that it is a very common disease affecting around 25 to 35% of general population? Hello everyone, I am Dr. Mitra and hope you are all doing well. Today I'm going to talk about a recent article introducing one of the most effective diets of fatty liver disease among all other diets which were introduced already. First of all, let's go through the function of liver and what it actually does in our body. The liver is a large organ located on the right side of the belly. It cannot be felt because it is covered by the rib cage. One of the main functions of liver is filtration. Liver filters the blood and breaks down the harmful substances, and then these products enter the bile or blood. When harmful substances are broken down into bile, then they are incorporated into stool and leaf body. And when harmful substances are broken down and enter the bloodstream, again they are filtered in the kidney and they leave the body as urine. Another important function for liver is digestion. It plays this role by secreting bile. Bile is produced by liver and then stored in gallbladder. And whenever we eat food and the food is entered in our intestine, the bile is secreted from gallbladder in order to break down and absorb the nutrients. And what happens when someone develops non-alcoholic fatty liver disease? Non-alcoholic fatty liver disease occurs when excessive fat is built up in our liver and it's not due to heavy use of alcohol. The global Western diet, which is characterized by excessive fat and fructose consumption, has been suggested to contribute to non-alcoholic fatty liver disease, which is currently leading cause of chronic liver disease in the world. Although it is called fatty liver, but multiple recent studies have suggested that added sugars during processing or preparation of food and averages play a causal role in developing non-alcoholic fatty liver disease. The most commonly used added sugar is fructose. And in a study in 2017 on obese men, provided evidence to support the hypothesis that a proportion of non-alcoholic fatty liver disease is due to consumption of high amount of fructose. But why is it important to diagnose fatty liver disease at early stages? Because if it is not diagnosed and controlled in early stages, it can lead to inflammation of the cells and progress to death of the cells, which is called cirrhosis, in which the liver loses all its functions, and then the only treatment is liver transplant. The most important approach for reversing fatty liver is lifestyle changes. If you are overweight, you should lose weight by exercise, by changing your diet, and things like that. But in terms of diet, diverse diets are suggested by dietitians and specialists for fatty liver disease. And one of the most popular diets is Mediterranean diet. But there are different types of Mediterranean diets. And in the study I'm going to talk about, in a clinical trial, they have been compared. So keep listening and see what is the most effective one to control non-alcoholic fatty liver disease. First of all, let me give you a short explanation about this diet. Mediterranean diet is based on the way people ate during 1960s in Italy and Greece, and they lived longer than most people in the world, and they had some of the lowest rates of chronic diseases such as cancer or heart disease. The Mediterranean diet consists mostly of plant-based foods such as whole grains, beans, vegetables, fruits, seeds, and olive oil. It also includes certain amounts of fish, poultry, eggs, and some certain sorts of cheese. And red meat is seldom eaten. And foods like sausages, hot dogs, brownies, cakes, and cookies rarely appear in this diet. And they also rarely eat processed fats like the ones we buy from supermarkets, and their main source of fat is olive oil.
A form of the Mediterranean diet includes more green plants is suggested to reduce the risk of non-alcoholic fatty liver disease by half. This is according to a study conducted in collaboration with researchers from Harvard University. The so-called green Mediterranean diet, which includes daily consumption of green tea and an aquatic plant called mankai. This tiny vegetable delivers a nutritional punch with vitamin B12, iron, folate, choline, and is a complete plant protein.
Both green tea and mankai contain beneficial compound known as polyphenols. The polyphenol decreases inflammation of hepatic cells, and it also contributes to decrease fatty liver dysfunction. During an 8-month clinical trial, researchers followed 294 patients. They were adults with abdominal obesity, and then they were divided into 3 groups with 3 dietary strategies. The first, standard nutritional counseling. The second, Mediterranean diet. And the third, green Mediterranean diet. All the 3 groups lost their liver fat, but those in the third group, I mean the green Mediterranean diet, had the greatest reduction. They lost 39% of liver fat compared to the second group, which dropped 20%, and the first group, the nutritional counseling, which dropped just 12% of their liver fat. This study shows the great efficacy of green Mediterranean diet. As a result of this study, the new strategy of green Mediterranean diet, which is rich in green plant-based proteins and polyphenols as mankai, green tea and walnuts, and restricted in processed or red meat, can double loss of liver fat than any other nutritional counseling or other types of diets. And please pay more attention to your liver. Non-alcoholic fatty liver disease can start even from childhood, and it is most of the time silent, and maybe sometimes there are symptoms like nausea, fatigue, tiredness, that they are general symptoms that can be mistaken by any other diseases. So be careful, and if you are diagnosed with this disease, try to reverse it by healthy lifestyle changes such as diets, exercise, and reduction, especially in amount of fructose. Hope this video has been useful for you. Please like, comment, and subscribe my channel. Thank you.